I have a very rooted chin. I'm not happy with it.
Okay, cool. Very straightforward case of chin augmentation. We can do via genioplasty and jaw sculpting.
Also, I need little sharpness in the jaw.
You should get it when we do this itself.
Not necessarily anything else.
No, I don't think you'll need it. Just with this, we'll be settling both. Why I say that is because the cut, I can vary the cut. So your lower jaw starts literally from here, the angle all the way here. So if I make the cut a little bit more behind, then the muscles also get pulled and comes forward. So you'll get a jawline. This area will get cleared. Vertical height you will get. Horizontal projection you'll get. Everything you'll get.
Okay, if I require little prominence in the jawline.
You will get it with this.
Only this is.
Yeah, I can do up to 15 mm, 14 mm.
And I actually have removed beard, so I've seen my face after very long. Do I have some asymmetry or?
Very minimal, and we will address that also. Whatever is there on the scan.
Okay.
This side is probably a little bit more 2-3 mm more swollen or more outside than the other side.
Okay.
That will get addressed automatically again in the procedure.
So you will reduce this or increase?
No reduction for you, only augmenting. So if that's 3 mm more, I'll augment this more than 3 mm than that. So if let's say this is 3 mm more, then we augment this 3 mm more than this side because I'm going to augment both sides. We're going to get the chin forwards and downwards.
So you know better. Right?
Yeah.
So you will basically...
Just with this one procedure, everything, all your concerns will get taken care of.
Okay. And how much is the...
So we will take a scan and plan it out. We can do a maximum of 14 or 15 mm. Okay. So we will do something. That's a lot for you. You'll be perfect with that. You don't need 15 mm. You might need 10, 12.
10, 12.
We'll get the exact figures with the scans.
Okay. So we'll...
And also we'll see the place the nerve comes so we can... See what happens. Now we've decided what procedure you would want. I will write that down. My team will tell you the costing. Your recovery is going to be about 5 days. So whenever you want that, we can take the scan. And once the scan is taken, we can sit again and then discuss a little bit more with the scans before you go in for surgery. That's how it's done.
So I have few more problems.
Sure.
Basically, my jaw clicks on the right side.
Okay.
So it's subluxation. I don't know the name. Something like that it is called. I have seen doctors before also. And they were like, simply put a splint in the night and it should be fine. So I thought maybe, not sure, maybe this surgery would...
This surgery, we should not help it.
Okay, this is different.
Yeah, this will just... This is more of a procedure under the, below the joint. Nothing will happen to your joint. It usually will remain the same.
Also, in that case, just a question. Do I need bi-jaw?
No, I don't think so.
No.
If you do bi-jaw, what will happen, I'll tell you. If you want, let's say, this angle to be strong and sticking outside or something, then a bi-jaw you'll need. But if you want the jawline, this is the jawline. If this to be defined and this to be correct projection, you don't need bi-jaw.
Okay.
That's the thing about the bi-jaw. Your bite is quite good. So I can retain the same bite and do a bi-jaw also.
Okay.
Your aesthetic demands, if it's only chin, submental, double chin, and the jawline, you don't need bi-jaw.
So if my bi-jaw fixes TMJ, shouldn't we do that?
That also we can't be sure. There's a good chance it might fix it, but I can't guarantee you that.
Okay, like that.
It tends to fix. That's what I can say.
Okay.
Meaning, a lot of patients benefit indirectly, not directly. When I do the chin, I'll definitely tell you no benefit, 0%. So that's the balance that you have to make a call.
Okay, but we cannot be sure that my...
No, nobody can be sure because we're not actually directly working on the joint.
Okay.
We are changing the position of the joint by moving the teeth and the other parts of the jaws. Okay. Usually it improves.
Usually, okay.
But yeah, there are chances where it doesn't improve. Okay. We can't be sure that in 10% of cases it will improve.
Okay. I have my CBCT with me. I'll show you that. Basically, I've got it done in Delhi only. But I will do it again, no problem. So this is the CBCT scan. So I'm not sure if you see there is a little asymmetry. Like this whole.
That we can measure when we take it here on the software.
Okay.
But it's not going to be more than 2 or 3 millimeters. The asymmetry is very minimal.
Okay.
You only have to tell me if you want more strong jawline here, like very masculine. If you desire that, do you have any snoring or something like that?
I have good sleep.
So no snoring.
I mean, it is very subjective when someone says strong, like, because I need strong, but not too strong, not hyper.
See, when I say strong, I only mean stronger than where you are right now.
Okay.
So if you want a angle here more masculine than what it is right now, then you are a candidate for bi-jaw. If you're not so much concerned about this part of your jaw, only the rest, just this genioplasty jaw sculpting, that's enough.
Okay.
So that is aesthetic concerns. I'd already told you the functional aspect. If you do genioplasty or chin augmentation, definitely will have no effect on your joints. But if you do the bi-jaw, indirect effect is there. On a good percentage of patients, their problems reduce in terms of the clicking and stuff. But we can't be sure.
Okay.
There's no way of saying, yes, I can cure your joint problem with this. No, that is also not possible.
Okay. If I want a prominence in the line,
then just the chin augmentation is enough. If you only want a stronger line, what I'm suggesting, the first option, that's more than enough.
okay. Like, I don't want too hyper masculine. I don't want that.
Then best is to just go for a chin augmentation, see how it
This
does.
is just for illustration. I don't want it exactly like this, but something like this would do.
This is very strong.
This is very strong.
Yeah, look at the mandible here. Under the ear, the jawline is here, really strong. It's like this.
This is strong. This
Yes, very, very, very strong. Okay. If you do a bi-jaw, I can get you 80% of this or 90%. Not even 100%, even with a bi-jaw. This is very, very strong jaw. Super strong jawline.
Okay.
That will be 1.5 centimeters of extra bone than what you have.
Okay. I mean, even little lesser than that would do. I just want my prominence to be there.
Then just get the chin augmentation, see how it looks.
Okay.
If you're fine, leave it. Otherwise, 6 months later, we can still do a bi-jaw.
With chin augmentation.
Yes, sure. Yeah. So, I mean,
What would you recommend? Like, then
it depends on your aesthetic concerns, really. I think just a chin augmentation will suffice.
Okay, and it will give me good line also.
It'll give you a good line. It won't give you that kind of a straw jawline, but it still give you a better jawline.
Okay.
See, because bi-jaw is, I would think, a much major intervention than a genioplasty, chin augmentation, jaw sculpting type of procedure. So the logic is to do as minimal a procedure as possible
Yes, correct.
and get maximal benefits. That's my logic. So, and that's the case, then I think you should do chin augmentation and see it. You'll find a lot of them are satisfied. If you desire more, there's always a scope for more. But then you can think about it later on, rather than doing everything in one go and,
Yeah. Okay.
done. So I plan for this. And let my team know when you would want to get it done,
Yeah.
so we can
I
accordingly
do
plan.
not need that by jaw.
I have not written that. If you want, we can do that.
Actually, I'm just,
That's the jawline. You have to decide. See, these are,
pretty
see,
sure how much results I'm going to get with only chin.
just this will come forward and the vertical height will increase. You won't get a jaw like that.
I won't.
No. But this will go away. Just imagine your own face. Do this. Huh? Something like this. You can look. Not that part, only this part.
This will improve.
Not so much there. There it will not improve. Because you're going to cut from here only.
Okay. But then this is more outer.
That I'll correct anyways. Asymmetry part, you don't worry. That will get done even with the chin procedure.
You will not reduce this, right?
No reduction.
No
We're
reduction.
trying to augment this.
Basically bring this like this.
Cut and bring the bone outside.
Oh, like that. You will cut and you do that.
Hmm.
Wouldn't that bring some line here?
So we have to give you a line, right? The jawline.
Yeah.
So that will be fine with that. It'll just merge with that.
Okay.
I'll do one thing. I'll just write the other option. Also, you can talk to them about the costing and then you decide.
Both costings are different.
Yes, of course.
Okay.
So one is maybe 1/3 the cost of the other. The buy job which you use, yeah, it's almost 2/3. It's much more expensive because we have to make 3 osteotomies. This is 1 osteotomy.
Okay.
Recovery also by jaw, you need to stay with us for a minimum of a week. Genio is 4 days. So double recovery
I
time.
have work from home.
That's okay. Then you can manage anything.
Next day I can work
Yes.
in both the cases.
By jaw, maybe 2 days you give it. You could work technically.
Mhm.